All right, thank you so much for joining us today. I am Dr. April Moreno, founder of the Autoimmune Community Institute. I welcome you to our talk today with Madelyn Cabrera on occupational therapy's role with lupus. I guess really briefly before we begin, just introducing you to the Autoimmune Community Institute as well. We are an autoimmune nonprofit organization dedicated to health equity in services, support, and resources and information. And our website is at acicommunity.org. Look out for more information about our upcoming events and things like that. You can join our newsletter and so on. So, yeah, without further ado, I introduce you to Madelyn Cabrera, who is going to be presenting today on occupational therapy role with lupus. Thank you, Madelyn.
All right. Hi, everyone. I hope you all are doing well and you're staying cool, especially right now. The weather's been really hot lately. So today I'll be talking more about occupational therapy's role with lupus. Thank you so much to April and the Autoimmune Community Institute for the opportunity. And yeah, I just wanted to share a little bit more on our role with lupus and also similar rheumatic and autoimmune conditions. Right. Okay. Yes, so just some background about myself. I'm an 8th term occupational therapy doctoral student. So this is actually my last term of OT school, and I'm working on a capstone that's focused on raising awareness on occupational therapy's role with individuals diagnosed with lupus. And the reason I chose that topic was because I have a close relative who is actually diagnosed in her early 20s. So I saw that having an autoimmune condition such as lupus can impact so many areas of your life. Young adulthood and adulthood in general is already hard to navigate, especially with just finding yourself, finding your confidence, maintaining your job, also managing your healthcare. So on top of having that with an autoimmune condition, it can be really difficult to do the things you want or need to do. So once I entered the OT program, I learned a lot about how OT helps a lot with having individuals participate in meaningful activities despite whatever disability, injury, or any setback that they encounter. So I really wanted to advocate more for OT's role within the lupus healthcare team. All right, so for this presentation today, I'll just be going over defining what is occupational therapy. So I know a lot of people are familiar with occupational therapy, some are not at all, and some probably have a small understanding of what OT is. So I, for one, didn't know exactly what OT was and how broad our scope of practice is until I entered the program. So that's something I really wanted to share. I'll also be going over occupational therapy's role with lupus specifically, and this can also apply for other conditions that have similar symptoms. And then I'll be going over different examples of disease and lifestyle management strategies. So these are different interventions that OTs can provide, and then I'll be going over how this can be applicable to day-to-day life. All right, so let's define occupational therapy. Occupational therapy is a healthcare profession with the main goal of promoting health and well-being. So what makes us unique is that we focus on helping you do things that you want or need to do within your daily life and whatever is meaningful and purposeful to you. We have a holistic approach and we understand the patient as a whole. So we understand what the patient wants out of therapy, what are their needs, their strengths and limitations, and also their context, whether that be physical, mental, social, financial, all of the above when carrying out interventions. Okay, so what areas do OTs work with? This includes, but is not limited to, activities of daily living, also known as ADLs. So if you never heard that term before, ADLs are basically your normal day-to-day self-care tasks. So this includes brushing your teeth, making your bed, making breakfast, taking a shower. So those basic self-care tasks, we definitely go over and we assess if you're able to do them. We also work a lot with health management, which is really important with chronic or autoimmune conditions, especially. So we can help with navigating doctor's appointments, managing medication, keeping track of your symptoms, those types of things. We also work a lot with maintaining employment and making sure that you're able to stay in school. So of course, with lupus, there are times of having flares and increase in symptoms. So it's pretty hard to maintain employment, especially when staying at work or having the accommodations you need. So OTs can help a lot with navigating those areas and helping you find those accommodations. We also help a lot with maintaining hobbies or leisure activities, things that you just love to do. So whether that's painting or going outside, playing with your dog, taking care of your dog. So those types of things. We also want to make sure that we're able to help you in those types of areas. All right. So other areas that are important that we work with is family and caregiver training. So this is especially important when patients are coming out of the hospital and transitioning back to home. We want to help educate your caregiver and also your family members on your condition and how to safely help you, especially when therapists aren't around, because that's just going to be your normal day-to-day life. And it's important to just educate them on how they can be safe and helping you. We also work a lot with home safety, fall prevention, and accessibility. And again, that's also very important when working with, when transitioning back to home, especially from the hospital. So we want to make sure that where you're going back to is safe for you. Sometimes you're not going to be in the same physical state as you were before coming from the hospital. So we want to make sure that everything is accessible for you. We want to know things like how many steps do you have? Are there handles that you need, grab bars in case you're able, if in case you're there's a chance that you're going to fall. So we really want to see those areas, and that's also another thing we want to talk with caregivers. We also work with driving and community mobility. So of course, with having a chronic condition, sometimes it might be difficult with transportation. So we want to help you find the accommodations or even help with assessing driving to see if it's safe for you to get around and do the things that you need, that you want or need to do. Okay. So what's unique about the OT perspective is that OTs understand person, their environment, their occupations, and how they all have play a role in health and well-being, that they are all of them are part of a dynamic relationship. So OTs also consider personal factors, which are really important. This includes health conditions such as lupus, psychological assets, and also your lifestyle. We know that no person is the same as another, so we take into consideration your lifestyle and how we can integrate different interventions. Okay, and what does OT's role with lupus look like? So this includes, but is not limited to, things like symptom management. So of course, with lupus, it comes with an increase in symptoms. So, and also remission. So we want to help navigate those situations when you do have an increase in symptoms and possibly come up with a plan so that you're better prepared and it doesn't disrupt your lifestyle. We also specialize in physical agent modalities. So that's a big term, but basically we specialize in the therapeutic use of thermal heat. So if you've ever been to hand therapy or physical therapy, a lot of therapists are specialized in this area, and they can use heat such as hot packs or paraffin wax to dip your hands in to help increase blood flow, increase range of motion, and decrease pain. So that's pretty common, especially with arthritis patients or patients who simply have joint pain. We also work on providing strategies for energy conservation and fatigue management. So these are different strategies we can provide that you can integrate into your day-to-day life that can help you save your energy. And I'll go into more detail with that in another slide. We also work a lot in providing education on joint protection. So joint pain and inflammation is a really common symptom of lupus. So we want to help in preserving your joints and making sure that they're safe whenever you're doing day-to-day tasks. Stress comes with a lot with a chronic condition such as lupus, and I can't even imagine how stressful it can be having an autoimmune condition and also managing your day-to-day life. So OTs help a lot with providing different coping strategies to manage your stress. We also work with adapting or simplifying tasks in the environment. So this also helps with stress as well, but also helps with safety and we can just assess what areas that you do your occupations and see if there's ways to help you do it easier or more comfortably. We can also provide recommendations on adaptive equipment. So this can also go hand in hand with joint protection and energy conservation. So we can provide recommendations on something like a reacher to help you grab things from the floor so that it prevents you from bending down to grab it. It's also a safety thing, and we can also provide recommendations on if you're experiencing joint pain, having like a long handled tube, a thick tube to put on everyday objects like a spoon, a pen, so that your grip isn't as excruciating and isn't as painful. We can also help with integrating medical recommendations with routines. So, of course, with medications and also with lupus, there's a lot of side effects, and some patients experience skin sensitivity and sun sensitivity. So, especially right now in the summer, while it's really hot, we can work on providing any tips on sun protection so that you're still able to go out, but also do it safely. Physical activity is also really important with having a chronic condition. And it also helps decrease pain. So we work a lot on helping you integrate physical activity to your day-to-day life, and also see what your strengths and your limitations are, and what is accessible to you. We also work with cognition too. So we do have cognitive assessments that we can carry out, and also we can work on breaking down tasks so that it's easy for patients to follow or use visual cues. So we work specifically to understand if you have any cognitive limitations and see how we can work around that to make your occupations easier. A lot of OTs also are experienced in splinting and orthotics. So we can provide recommendations for splints or create orthotics for the occupational therapists that are specialized in hand therapy. And this can also help with like range of motion, maintaining joint protection, and also just maintaining the integrity of your joints. Okay, that was a lot of information, but I'm just going to highlight a few specific interventions that OTs can provide. So fatigue is a very common symptom of lupus. So just wanted to go over energy conservation a little bit deeper. Energy conservation is defined as a strategy that involves adapting how you complete your day-to-day tasks so that you're able to save your energy for the things that you want or need to do. Some benefits with energy conservation are helping reduce the tension on your heart, reducing fatigue, shortness of breath, and also stress-related pain. So the main goal of energy conservation is just finding balance within your work, leisure activities, and rest, being able to save energy in between those areas. Okay, so some examples of energy conservation include what we call the 4 Ps. So prioritize, plan, position, and pace. One tip that we have is to prioritize tasks that need to be done first and make other tasks secondary. So if you need to do something earlier in the day, like do laundry, and you need to also dust the kitchen, first do the tasks that you need to do and make that a priority first, and then whatever you feel can be pushed off for the next day, do so that you can save your energy. Also, if you're overloaded with multiple tasks, begin with the most important one first. That way you know that it gets done and you don't overwhelm yourself. Another strategy OTs can provide are to just plan. Plan out your activities ahead of time so you avoid additional trips. So, for example, plan out a grocery list so that you know exactly what you need to buy when you're at the grocery store, or when you're cooking a meal, have those ingredients out there and planned out so that you're not using energy to look for them. Also, alternate between light and heavy tasks. If you have something that is as energy exerting as doing laundry, and then you also have to wash the dishes, try to space that out within the day. Maybe try to do one in the morning and then one in the late afternoon. Also, plan out your days. I know this is easier said than done, and it's something I struggle with myself, but plan for a good night's sleep throughout the day. Sleep is very important, and it's something that keeps us really energized so that we actually have the energy to do the things we want or need to do. Another tip that I have is position. So, body position actually plays a good role with energy conservation. So, avoid excessive bending and reaching when you're either on the computer or grabbing objects from the floor. This actually increases fatigue and shortness of breath. If you can, try to use assistive devices. You don't have to, but those are some ways that also help with saving energy. So something like a reacher. A reacher is something that you can use to grab objects from the floor, or maybe grabbing your laundry from the washing machine. Also, maintaining an upright posture when sitting and standing. This is really helpful, and it actually helps increase oxygen going into your lungs instead of hunching down. That's an issue that is really common with people, but just being mindful of that can help. Also, sitting when possible when completing tasks. During field work, we actually had some patients who also experienced fatigue. So some suggestions that we would provide is just to simply sit when you're able to when doing things like uh, folding clothes, drying your hair. So that's just going to save some energy in the long run. Pace is going to be another form of energy conservation. So just simply maintaining a slow and steady pace, breathing slow and steady as well, and taking short rest breaks in between tasks. So something like folding your clothes, for example, you can take a 20-second rest break and then continue to fold. So make sure that you're not going full force when completing a task. Also, try to delegate tasks if possible. If there's something that you think that you can tell someone else, either in your family or someone really close to you to help with, try to do so. All right. So the next area that I'll be going over is joint protection. As I mentioned, that's a very joint inflammation and pain is a really common symptom of lupus. So the definition of joint protection is just a group of suggestions on modifying activities with the use of ergonomic positioning, which is just proper body mechanics and adaptive techniques, or adaptive tools to lessen joint and stress damage. So this includes, but is not limited to, respect for pain. So understand that pain will be there, but don't keep it from limiting you from doing the things you want. However, if it's too painful, then that's something to bring up to a healthcare provider or maybe your therapist too. Having a good balance for work and rest is also vital for joint protection. So overuse of joints is also gonna increase symptoms even more. So it's definitely easier said than done, depending on your job or what your tasks are for the day, but trying to create balance and finding the accommodations to create balance would be really helpful. Another tip is to avoid positions that cause deformity or staying in one position for a long period of time. So as you can see on the diagram here, you can see that in the picture, they're holding the object with their thumb and their fingers. So these are much smaller joints, but here, this is actually better protection for your joints and less exertion. You'll be using your shoulder and your elbow, which are larger joints, and multiple joints at once. Also in this diagram here, so this may be an awkward position for your hand to be holding a utensil. So using a more comfortable position such as this. Also using adaptive devices if you can when doing things like opening a tight can. So that's going to be really helpful in decreasing the pain that you're feeling in your joints. Stress management is also an area OTs can provide some strategies for. Stress is inevitable. A lot of us experience stress in one area or another, and stress can increase symptoms, especially with an autoimmune condition. So some coping strategies that OTs can provide to manage stress include, but are not limited to, gentle stretching. So gentle stretching, whether that's in your hands, your arms, your legs, this can be really helpful in decreasing the tension that you feel from your muscles, especially with stress. Also, breathing exercises. So I'll be going over a couple of different examples for breathing exercises on the next slide. Also, use of your senses. So OTs can also work with providing mindfulness activities. So being able to visualize yourself and really really use your senses, whether that's looking at something peaceful or feeling something in your hands, using a stress ball, those types of things. We also can provide recommendations in journaling. So channeling your thoughts in a journal. For me personally, that has also been helpful, but it can also help you be more mindful of what's on your, what exactly is overwhelming you, and being able to break that down. Physical activity is also another area that we recommend for patients. So whether that's just taking a light walk or doing something like yoga, low impact activities. We can also provide recommendations on simplifying tasks or modifying the environment. So especially with an environment that probably has a lot of objects around, or if something that you're doing has a lot of steps, we can provide recommendations on simplifying those tasks to take out the stress. All right, so I'll be going over breathing techniques. So examples of breathing techniques that OTs can provide include pursed lip breathing. So this is basically when you inhale through your nose, and you could do it with me if you like. So you're going to inhale through your nose with your mouth closed, and then exhale through your tightly pressed lips. So one thing that an OT has told me is to tell patients, smell the roses and then blow out the candles. Can help a lot with stress management and also help with fatigue. Another breathing technique we can provide is box breathing. So this is called box breathing because it goes 4, 4, 4, 4. You're going to inhale through your nose for 4 seconds, hold your breath for 4 seconds, exhale through your mouth for 4 seconds, and then hold your breath for 4 seconds until you start again. So you could go ahead and do it with me. We're going to inhale, hold your breath for 4 seconds, and then exhale. So that is something that we can do whenever patients are experiencing a lot of stress. And that's also something that we can all do, especially even for myself. So I'm glad we ended off the presentation with a breathing technique. So if anyone is interested in getting OT services, these are some tips that I put together personally that just through talking to patients with lupus, other providers, and OTs in practice. So one thing I want to provide is just to keep track of your symptoms. Try to keep a journal with you, or even on your notes app, and keep track of the symptoms and dates, and also the context of maybe what triggered it or where you were at. So this is really important. It's just to be prepared when you're seeing your rheumatologist or any of your healthcare providers. Of course, appointments are really hard to come by, and sometimes it takes a while, and sometimes they're really quick, maybe last for 10 to 15 minutes. So it's going to be really helpful to be prepared. Also share how your symptoms impact your daily life and your ability to do the things you want or need to do. So this can also include how you're feeling stress-wise, mentally, emotionally. So any areas that you feel are impacting your day-to-day life. And lastly, ask your provider about OT services to determine if it's the right fit for you. Explain your symptoms, and also explain if it impacts your day-to-day life. Okay, so this is just a quote I wanted to provide. I can be changed by what happens to, to me, but I refuse to be reduced by it. So not only is this applicable for patients with chronic conditions, but for everyone else. Um, Sometimes we can't control the things that happen to us, but it doesn't keep us from leading a meaningful and purposeful life. So since I'm still a student, that's something I really want to advocate for patients, is just making sure that they're still able to do the things that they want or need to do. All right. Thank you so much for attending. If you have any additional questions or would like to reach out, feel free to email me at my email below or contact Autoimmune Community Institute.